What exactly does fatigue or fatigability mean with regards to nystagmus or BPPV? Hi, Peter Johns here, vertigo enthusiast and retired emergency doctor. Have you ever heard your colleagues use the term fatigue or fatigable or non-fatigable when they describe nystagmus? What do they mean by that? And is it the correct use of the term? As I sometimes like to do, I'll give the short answer first. Fatiguing does not mean that the nystagmus is of short duration, and non-fatigable does not mean that the nystagmus persists for many hours or days. And persistent nystagmus does not mean that it's more likely to be a central cause. And what fatiguing really refers to is that if you were to do a Dix-Hallpike test and get a positive test, if you were to immediately repeat the test and perhaps did it 2 or 3 times, the nystagmus and vertigo that the patient would experience would get less and less and perhaps even stop. That is what fatigability is. And it's no longer recommended that you test for fatigability. If you see the classic positive Dix-Hallpike test that looks like this, you can just go ahead and do the Epley maneuver and cure the patient. So that's basically what I'm going to cover in this video. If you understand that perfectly, you can stop watching now. But if you want to know why I think this is a bit of a problem when it comes to the clinical assessment of nystagmus and the treatment of BPPV, I'll explain more in this deep dive. Are there any times when fatigability or fatigue is an appropriate term to use in medicine? Well, yeah. In myasthenia gravis, if a patient already has some left eye ptosis and you have them look up and look around for a while, you'll find that their eyelid will start to droop more, and this is fatigue. But fatigue can also be used inappropriately, as in adrenal fatigue, a condition for which there's no scientific basis. So does fatigue have a place in vertigo? To answer that, we have to go back to 1921 when Barani first described the nystagmus in BPPV, and he observed what would be called fatigue or fatigability. He noticed that if you repeated the positional test 2 or 3 times, that the nystagmus and the vertigo that the patient experienced became less, and in fact it would stop altogether. But if you let the patient rest for a while, a repeat test would again show nystagmus and the patient would get dizzy. Dix and Hallpike saw the same thing in 1952 when they described in more detail the positional test that would end up being called the Dix-Hallpike test. And some years later, people would start referring to this property as fatigability. And in the pre-Epley maneuver era, it had some diagnostic utility in that since you couldn't cure the patient, it was nice to be able to do another Dix-Hallpike test and say, oh yeah, no, it's fatiguing just like BPPV does. So it would reassure the clinician that in fact they were dealing with BPPV. Now in the post-Epley maneuver era, if you see a patient with a typical story of BPPV and the typical nystagmus of BPPV in the Dix-Hallpike test, there's no reason to test for fatigability. Just do the Epley maneuver, wait 15 minutes, repeat the Dix-Hallpike test. If it's negative, you've just diagnosed and cured BPPV. So how is the term fatigability being used by vertigo experts today? In 2019, Edgars, along with a number of other world-famous vertigo experts, wrote a paper where they described, again, fatigability being something that happens when you repeat a maneuver and the response becomes less. And in 1999, Furman and Cass wrote a very nice review article in the New England Journal of Medicine about BPPV, and they also stated that's what fatigability was, that if you repeat it, it gets less. They also recommended that you no longer test for fatigability because it may interfere with the treatment, which is an Epley maneuver. And in 2017, Bhattacharya wrote a very nice clinical practice guideline and also states that fatigue is a reduced response when you repeat the Dix-Hallpike test, and also stated that you should not do it, not only because it might interfere with treatment, but because it's very unpleasant for the patient. So we now know what fatigability is and that we shouldn't be testing for it, but what's going on when people were testing for it? This nice little video by Jean Laurin shows what happens when you or a monkey turn your head to the left and right. The fluid whooshes back and forth and lets your brain know that your head is turning left and right. So that's what happens when your semicircular canal is working properly, but what happens in BPPV? In that situation, some of the little crystals in the utricle, which normally reside there, break off and then move into most commonly, the posterior canal And there they are going into the posterior canal, and the patient's now sitting up, and the ear rocks are not moving around. But when they lie down in bed, they move quite a bit, which moves the fluid within the posterior semicircular canal, and they get intense vertigo and nystagmus. And if the patient were to stay lying for a while, then sit up, the crystals would again move, and you would again get nystagmus and vertigo. The most popular theory as to what's causing fatigue during the Dix-Hallpike test is that during the first Dix-Hallpike test, some of the crystals would disperse a bit, and being smaller would generally make a smaller stimulus. And if you did a Dix-Hallpike test enough times, they would disperse enough that you would have no nystagmus and no vertigo. I can't find a video of fatigability being demonstrated in the patients anywhere on the internet, and I've never tested for fatigability because if I see a positive Dix-Hallpike test, I just go ahead and do the Epley maneuver. Fatigability is the reason that when I work with learners, I tell them if they're tempted to do a Dix-Hallpike test, don't do it until I'm in the room so that I can see what happens in the first Dix-Hallpike test. Now, over the years, I've come across clinicians using the term fatigue or fatigability in ways which are not consistent with what we just discussed. So in order to test the waters, I posted a question on the emergency medicine subreddit as to what they thought fatigue or fatigability meant with regards to nystagmus or vertigo. And the first two answers I got were these. First, that it means if the head is kept still, it resolves after a few seconds. And the second, if it's fatigable, doesn't stop, then you should be more concerned about a central cause of vertigo, whereas if it's fatigable, then it's likely peripheral. So what I got from that is that they think if it's fatigable, it means that it's only lasting a short time and it's likely peripheral. And if it's non-fatigable, it's having persistent nystagmus, and that makes it more likely to be central. And they're not the only clinicians that seem to think this. Years ago, I came across this video where the author described fatigability in this manner.
Now, the last bit on here that I want to mention is the fatigability. And I'm specifically mentioning fatigability when we're talking about nystagmus. Eventually, it'll either slow and stop, and that means it's fatigable. That is more indicative of a peripheral problem than a central problem. If, however, the nystagmus continues, I'm going to say for at least over 30 seconds, then that is probably not fatigable, and it definitely indicates that it's a bigger problem, it's a brain problem, and we need to pay more attention to it.
So this person seems to agree with the answers that I got from Reddit that fatiguing and fatigability is related to the duration and perhaps whether it's a central or peripheral cause. About a month ago, I found this video where they discussed a very complex vertigo case, and the nystagmus was described as follows.
The patient now has a new direction-changing nystagmus with a rotatory component to both the right and left side, and it's non-fatigable.
Now, in this case, they did not describe a Dix-Hallpike test or repeating a Dix-Hallpike test, so I'm pretty sure when they say non-fatigable, they're describing nystagmus, which does not stop. And literally a few hours ago, I found on Twitter a case presentation about a man who presents with clearly a posterior circulation stroke, and his nystagmus is described as left beating horizontal nystagmus that does not fatigue. So this concept of fatigue and fatigability is certainly being used out there, but I can find no credible source of information to confirm that's a correct use of the term. In fact, in Edgar's 32-page paper about the properties of nystagmus, they do not use the term fatigue to describe how long a nystagmus lasts for. But it does suggest that you describe the duration and frequency of the episodes of nystagmus. For instance, in this lady whose Dix-Hallpike test is testing her left ear, she starts to get nystagmus just about there, and it lasts about 15 seconds. It's not fatiguing, it's simply starting and stopping. And the ideal way to describe it would be vertical upwards and torsional nystagmus towards the downward ear with a duration of 15 seconds. And the most common cause of persistent nystagmus, which lasts for hours or days, is vestibular neuritis, as this man has. And when he looks to the right, you can see that it's beating horizontally to the right with a torsional component. And when he looks to the left, it's still beating towards the right, although less. And again, it's persisting or sustaining for many hours or days. This woman also has sustained or persistent nystagmus, which is lasting for hours or days. And when she looks to the left, it beats to the left. And when she looks to the right, it beats to the right. Nystagmus that changes direction depending on the gaze is almost always caused by a central cause of vertigo. And it's not the duration of the nystagmus which is the clue, it's the pattern. So in conclusion, fatigue, fatigable, non-fatigable are terms that are often used incorrectly. Instead of saying these things, just describe the duration. Was it short duration? Persistent? Was it lasting for many hours? And if a nystagmus is prolonged, lasting for many hours, it does not mean that the patient is more likely to have a central cause. And also, don't test for fatigability. Instead, do the Epley maneuver, wait 15 minutes, then repeat the Dix-Hall-Pike test and show that you've cured the patient. Well, I hope this cleared up some confusion about the use of the term fatigue or fatigable. Thanks for watching.